I think we will go ahead and begin. It's 2 o'clock, and my name is Brian Degenhardt. I'm the director of the AT Research Institute, and I'm very pleased to begin this year's Research Nexus program. I appreciate um, Deb Roy's invitation to launch the year, and she'll be presenting later on in regards to the overview for the whole, or at least this semester's program, but also with a perspective for the entire academic year. Last year, and as we continue this year with the changes with COVID, it's an entirely new process, but I think it's going to in the end, facilitate the purpose of this particular program. So once again, I welcome everyone to the program, and I'm going to go ahead and begin sharing my screen. Okay, so today's presentation is just to give an update on the Research Institute. Every year we have some new faculty. With every program, we have different members of the university joining us. So we'll be giving a very brief overview about the center, so about the Institute and its centers, so everybody can be on the same page in regards to who we are and what do we do in regards to AT Still University. We have 5 center directors that are listed here. And there are currently 3 centers. As I said, you will get a brief report from each of them as we progress. So the Institute was established in 2002 prior to the establishment of AT Still University. At that time, it was the Kirksville College of Osteopathic Medicine. And our mission was to advance patient care and wellness through the development and support of premier osteopathic research. Over the next few years, as we evolved into a university, our goals and our objectives began to mature and to reflect the diverse makeup of the university. So our goal is to explore and to advance the scientific evidence base of osteopathic medicine and the associated health professions within the university. And we have several objectives or aims. First is to develop an infrastructure and culture that promotes interdisciplinary research regarding whole person healthcare. And so when you think about our traditional term of osteopathic medicine, if you want to think about osteopathic as being whole person, those were designed to be equivalent. But as we go through the presentation, we're going to see that whole person healthcare in the 21st century associated with this university is even broader than what that idea of whole person healthcare, of the mind, body, and spirit aspects of the human condition. We're going to see that it's far broader now as we go through the presentation. Another goal is to support clinicians and scientists and students in conducting clinically relevant research. In its earlier years, the university since the 1940s had been supporting certainly basic science research, but it wasn't until the 21st century that it really recognized that there were unique aspects to clinically relevant research and so needed an infrastructure to support their faculty and their students in doing this type of research. And that's one of the objectives of the Institute. It is to facilitate also dissemination and translation and to promote collaboration, not only across campuses and within the numerous disciplines within the university, but also within national and international research centers and entities. We are involved in research training and mentoring, and certainly the Research Nexus program illustrates one way in which we meet that objective. We also provide a framework to develop ideas and to prioritize research within our membership. And, when we look at the structure then of the Institute, we can see that under the area of research and grants now led by Gayla Sublett since last summer. She just had her first anniversary, so we're excited with all of the work that she has done in the past year and getting to know us and really taking on a new, fresh vision for the work that we are doing in research and grants. She, as well as representatives from research support and from sponsored programs, along with the center directors, make up our administrative team for the Institute. And we have 3 centers at this time that focus the work that we do. One is the Center for Oral Health Research, another for the research in osteopathic manipulative medicine, and the other is the National Center for Community Health Research. Currently in our institute, we have 56 scientists. We have 19 clinicians and basic scientists that participate in for the Center for Oral Health Research, 12 clinician and research associates for the Center for Research in Osteopathic Manipulative Medicine, 10 in the National Center for Clinical Health Research, and there are 15 that are unaffiliated with the specific centers because their work is, falls outside of those centers, but still receive support from the Institute. So as I said, we have right now about 56 clinician scientists participating in the work that the Institute does. And so let's now look at just briefly what's occurring in each of the individual centers. And so with that, I'd like for our first report for the Center for Oral Health Research, I would like Ann Spiralic, who is our one of our center directors, to lead that presentation. And I'll just go ahead and change the slides as you need it, Ann.
Great. Thanks, Dr. Degenhardt, and welcome everybody. It's great to be back for our first Nexus meeting this year. And I'm so pleased and honored to be able to tell you a little bit about what's happening in the Center for Oral Health Research on behalf of my co-director, Joan Davis, and myself. So let's see, Brian, if we could just kind of go forward. So we have a lot of different activities within our center. We are actually the largest of all of the Institute centers. And the overarching intent of the Center for Oral Health Research, it centers around building an infrastructure to support the growth of a cadre of researchers who have the skills to conduct research and participate in a variety of different scholarly activities, and to mentor novice researchers, including clinical faculty and students. And we also have the intent of developing the members of the center to serve as leaders in the translation of knowledge that we gain through our research activities, not only into best practices to support clinical practice, but also into the dental curriculum. So our mission statement is listed here for you. Our mission is to promote whole person health by translating outcomes gained through clinical, behavioral, and exploratory research into advances in dental education and practice. So you see our mission statement quite closely parallels the intent and purpose of our center. And the next slide, please. So we have some pretty well thought out and evolving objectives and aims. We just met as a center in the last year as part of, we always do this every couple of years as part of our strategic planning process within the center. So what you see here reflect our new objective and aims. The first one is, again, related to this infrastructure, as well as promoting a culture of research that's both inter as well as intra-professional, and hoping that those activities then go on to support the mission of our University of Whole Person Healthcare. We also have a lot of focus specifically on skill development, and that supports both students as well as faculty throughout all phases of the research process, with helping to build writing skills, skills and experience with using a variety of different methodologies, and then of course the translation of those activities into skills for presenting scholarly activities. We also have a mentoring program for faculty and students in the scientific process, again, that supports the development goal. And the next objective, thank you, is to, of course, encourage dissemination at in peer-reviewed journals, as well as presenting at national and international meetings. We help to foster faculty scholarship through faculty development activities, and we just hosted a big symposium here in the winter of our last academic year. We joined forces with the SRI as well as with the Arizona chapter of the American Association for Dental Research. So we try to have strategic partnerships that give us opportunities for dissemination, but also faculty development for training. And we hope to promote the integration of new knowledge through high sources of evidence. So evidence-based research is a major part of what we do, and translating that into the dental curriculum for best practices. And we have a very strong interest also in educational research within both of our dental schools, as I know is an interest across the university. And so we hope then that what we get through our good research gets translated into best practices, clinical practice guidelines that can then be incorporated into the dental curriculum, and testing some of those types of clinical practice guidelines in clinical care activities, but also helping to assess whether our students are learning that information and incorporating that into their decision-making and reasoning skills. And so we hope that this educational approach is based on strong instructional methods that are grounded in educational theory. And we have many faculty members now who are getting graduate degrees in education. So I think that's going to be a nice area of growth for us. And then last but not least, we hope to align our research and scholarly activities in compliance with the American Dental Association's new accreditation standard, that is Standard 6, which is all about research. And so what the accreditation standard does reflects a lot of what we have in our strategic plan. So as Brian mentioned to you, we have 19 scientists in our center. We span across 4 different schools on 3 different locations, right? Mesa, St. Louis, and in Kirksville. And all of our members serve in a variety of administrative, research, and clinical roles on our respective campuses. So we have quite the nice mix of people with different skill sets and interests and areas of expertise. So just kind of our last slide, our general areas of research focus on the influence of health and oral health behaviors on overall health and wellness. We like to study the impact of public health education on dental practitioner attitudes and behaviors towards treating the underserved. And many of our members in our center work with a lot of individuals with special needs who are medically complex as well. And then we have another area of research that's inter and interprofessional education and collaborative practice models to improve patient safety and care. But we have other areas of research as well. So we have very strong interest in dental materials sciences, for example, and certainly some of the microbiologic components of oral health and some implications not only in oral disease and prevention of oral disease, but also how those types of infections influence systemic health. So it's a nice mix, and we're looking forward to the new academic year to continue our activities. Thank you, Brian.
Yeah, thank you, Ann. Very succinct and clearly a dynamic center. Your work is and your leadership has just really been creating a lot of interesting research and growth, and they're constantly looking for people to bring into their center and to collaborate with. So if you have any ideas, don't be shy around Ann. She will definitely find ways to advance them.
Yes, so please reach out to Joan Davis in Missouri or myself, and we'd love to have you join us. So thank you.
One of the points that Ann said is that we acknowledge that our primary mission at this university is as educators. But being educators, we are also, required to advance our field. And so becoming clinician scientists is really very important. I mean, Ann I think you had clinic this morning. I mean, it's just the nature of the beast of people that are part of the Institute. And it really, for me, it really just completes my whole career by being able to see patients, to see where things work, where they don't work, to generate questions, and actually then deliver them and find ways to do research around those ideas is really a fulfilling way of working. So next we're going to look at the Center for Research in Osteopathic Manipulative Medicine. This is co-chaired by Dr. Eric Snyder, who's the chair of the Department of Manipulative Medicine at the Kirksville campus, and myself. And in this field, we basically use our hands to both evaluate the neuromusculoskeletal and aspects of the circulatory systems, and over a century developed various tools to evaluate and treat a variety of conditions. And all of this was done pretty much anecdotally. It wasn't until the second half of the 20th century were there attempts to do research in this field, but it was very limited because of the complexity of and the dynamic nature of the neuromusculoskeletal system. So the 21st century and the development of technologies have definitely opened up opportunities for research in this field. And this is what this center is essentially leading throughout the world as a consistent developer and performer of research. As I said, this work is performed by humans, by their own hands, based off of an educational process they have. And so it's an issue of developing unique instruments in every student that is taught. So we have to assess the reliability, accuracy of those skills in every individual. We can't generalize from one person to the next, that if one person does a certain level of skills with both diagnostic and therapeutic tools, that's going to generalize. And so that makes this a very challenging field because with every group of students that come in, with every new graduating class, each student represents and each physician represents a unique instrument that requires assessment of reliability, accuracy, and componentability of their diagnostic and therapeutic palpation. There are at least 4 categories that are of tests that are commonly used when we evaluate the neuromusculoskeletal system. Those tests vary depending upon which body region that they are applied to. And so part of our goals within this institute is to evaluate what has been traditionally accepted models and principles of the musculoskeletal system, and we've decided to begin with the spine and the sacrum, which tend to be very key areas in this modeling to do our research. We are also developing ways to evaluate function within a clinical arena. Most ways of evaluating the musculoskeletal system, certainly through the 20th century, was primarily due to static imaging of structure and not function. And so this is one area that we have to develop to really be able to critically look at the effectiveness of this field. And then also to develop clinical outcome measures. And fortunately, this has become a priority within the medical system within this country and certainly globally over the last 2 decades. And so we are doing our best to utilize those tools that are now standard within the scientific world and the clinical world to evaluate clinical outcomes, both ones that are objectified through instrumentation as well as patient-reported outcomes. Our second objective is to identify and develop clinicians whose palpation skills achieve defined standards of reliability and accuracy so that they can not only participate in rigorous research to better understand and advance the field of manipulative medicine, but also to help improve the patient care that is given in this field to the general population. So this is an example of a lab we have here in Kirksville where we have our objective models, and we now bring through classes both within the university as well as groups from around the world to use these objective measures to provide feedback to help in the calibration of their skills. This is what it looked like last year. It does not look like this anymore because we have plastic barriers and so forth, just like you have seen in other areas of the university, trying to sustain safety for all involved in the training program. Our last area is to determine the clinical significance within this field. And we have developed a practice-based research network called DO-TouchNet. It is now just finished celebrating its 10th year, and it has become very quickly an international network. We have over 850 members globally, 475 within the US, and over 375 international members, representing over 15 countries and on 6 continents. Right now, over 110 members have contributed to the research that we have performed as a network, and each day we are working in incorporating more of our members into active clinical research. It is a challenge to help shift mindsets of people who have worked as purely as clinicians, that there is a way that they can, within their own practice, contribute to the scientific methods and scientific challenges and responsibilities that we have as clinicians. But we have that infrastructure, and we're building that each year. The last center is the National Center for Community Health Research, and this is led by Dr. Joy Lewis and Kate Willingham. They have created an alliance between ATSRI University and particularly with SOMA and the National Association for Community Health Centers. As is common with the community health center structure, they have an advisory board that help oversees their activities. That includes stakeholders, patients, and the community alliances that it serves. Its vision is to promote optimal health and well-being for underrepresented, vulnerable populations through the advancement of quality research. It is to conduct quality research that considers a range of personal, or in our parlance from earlier, whole person healthcare, as well as social, economic, and environmental factors that all influence health status. They focus on the underrepresented communities and vulnerable populations served by health centers and address health equity by improving health, wellness, and well-being. And they have reached out and are working very well with the Center for Oral Health Research in their work in developing programming for vulnerable populations and underserved populations. Their areas of focus is in supporting community-oriented patient care projects that involve second years medical students within SOMA, DOPH, MPH students within that program, as well as residents and fellows that are basically early career practicing clinicians. They have a primary care training enhancement grant that specifically targets these young early career clinicians to help develop their skills to be clinician scientists throughout their careers. They partner with the National Association for Community Health Centers, or NAC, in a variety of their research projects. And they focus also on medical education, technology to enhance active learning, and to look at and evaluate the social determinants of health. And these are just the common areas that they are looking at within their model of research and how these different areas influence the health of the populations that they are serving. So their core principles look at not only primary care and what's going on within the doctor's office, but looking at it more from a community and public health perspective. And that's what makes this particular center within the Institute so exciting, so dynamic, and so important within the university mission. So you may not appreciate this, but I'm going to give you a little kind of interesting perspective about the Institute. When we started in 2002, the only physical structure that we had is what's hanging above this door, the sign that says the A.T. Still Research Institute. We had no building, we had no offices, we just had people whose goal was to develop this idea of promoting clinicians doing research that are relevant for their patients and so forth. And over the years, we have grown in our centers and our resources, but in the end, we are still primarily just people in a lot of different locations working together to achieve our mission. And really, when we think about our issues associated with COVID, really that's what we're doing as a nation and as a global community, is that we're now working in very separate locations, but we still can come together and work around particular missions and objectives and goals. And so really the Institute mirrored this or developed this early on because we had very limited resources. We have a lot more resources than we certainly had initially, and that's the advantage of sustained growth over time. So the Institute is a university structure that promotes clinical research collaboration, and by doing that, our goal is to minimize redundancy. the many universities, and many of us have worked at those universities, where everybody, even in the university, works in isolated silos. They all need their own tools that are often redundant from one area to another. And the Institute certainly tries to leverage what resources the university has for research in a way that really focuses on the outcomes of the clinical outcome research and minimizing a lot of expense that would be led towards a lot of redundancy at other universities. All university faculty, staff, and external collaborators are welcome to become members of the Institute. This is not an isolated club by no means. If there is an interest, that you have a place. And new centers are always possible. We have had a variety of centers over the years, and depending upon how personnel have changed, how interests have changed, how funding opportunities have changed, that centers have kind of come and gone. And so to develop a center, it requires a team of faculty that have a similar focus on research with a long-range plan for that line of research. We encourage the faculty to use internal funding, which occurs on an annual basis, to help to build the research team. And once they have gained a little experience from internal funding and they're ready to say, yes, we are committed to sustain research in this particular direction, that they apply to establish a center within the university. And we have always been supportive for any group that has been able to go through those steps to become a center. So are there any questions in regards to the Research Institute before we look at the programming that we're going to be bringing in this upcoming year? Okay, so with that, I'm going to...
Hello.
Yes.
Good afternoon.
Good afternoon.
Yeah, just I have a question regarding the place. Suppose, for example, if I want to work in the research, but I haven't a place to work with. So, for example, if I want to work something on the animals, like on the mice or on the rats, so there is any possibility to get a place to work in, or what should they do like in this situation?
Yeah, so every location within the university has its own unique challenges in regards to facilities. And the facilities has its primary influence within the academic structure. So talking with the heads of schools, the deans of schools, and so forth is really an important step in establishing a space for beginning research. Certainly making the Research Institute and the Division of Research aware of those interests can certainly help increase the awareness and the need and the potential problem-solving options for getting research started. So certainly communicating with the Institute regarding your research interests, the needs for that research. But I would say when it comes down to actually creating space, that is not part of what the research division has a lot of control over. We have to work within the academic structure to find that space. Okay?
Okay. Okay, thank you.
You're welcome. But we are very interested in knowing kind of your interests and what it would require. So when there are opportunities that come up, we can be helping to identify them and making sure people are aware of your interests. Okay?
Okay.
Okay. Any other question?
Sounds good.
Okay, I'd like to turn things over to Deb, who's the head of the Research Nexus. And the Research Nexus actually got started 4 years ago on the Mesa campus as an initiative out of one of our annual meetings to help promote these objectives of looking at research training and mentoring as a mechanism for developing ideas and prioritizing research and to help in the dissemination, a translation of that research. And so with that, Deb, we'll have you go ahead and continue.
Thank you, Dr. Degenhardt, for that introduction, and very tough act to follow with you and Dr. Spolarz being so good with presenting thoughts and ideas. But I will try to carry on. So we did a survey. We administered a survey across all campuses of the university, and to elicit people's interest in different research topics so that we could figure out a program for this academic year. And we wanted to make it tailored to faculty and staff needs. So we had about 21 survey items, which turned into 25 with open-ended questions and faculty suggestions. And we had 38 responses in total from that survey, which is still open. And we kind of categorically merged some of the topics that sounded like they could be merged. And we are going to present on 4 of those topics this academic semester, that is fall. We have another slew of topics that will be that we are trying to get speakers for in the upcoming semester, which is spring. So this year, for people who have supported our program since its inception, you'll notice a marked difference. We have back-to-back sessions on the same topic, and the topics will be the first session will be discussing where somebody who is the speaker will be talking about the particular research item, and then next the follow-up session, which will be the following week from the first discussion. People will get a chance to bring their ideas and thoughts to the table, and they will get a chance to discuss problems and figure out solutions together. So here is a timeline of research, which is basically how it is conducted. First, we have to come up with a research question, followed up with coming up with a methodology to investigate that research question. Then we need to operationalize collecting evidence or data, followed by data analysis. Once the data analysis is done, we celebrate with a cup of orange juice. But then we have tried to follow this trajectory throughout this semester so that faculty and staff who will be attending these sessions will get a general idea of how to conduct their own programs. And it's not guaranteed, but if you attend all the sessions, you'll be able to follow if you have a basic idea of what you want to do, you'll be able to plug in information that are given from this these discussions into your research program and hopefully come up with a analysis plan or at least a proposal. Would you please change the slide? So the first item was how to write a research question. Dr. Davis has offered to speak on that. Unfortunately, this will just be a one-off session. because this is something that probably does not need a follow-up. And if you do, you have to reach out to us, and we will figure out how to help you out. And this would be followed by a session from Dr. Kaylee Welch-Bacon, who'll be talking about survey questionnaires and other qualitative methods to conduct a research research methodology. We also have Dr. Spolarch talking about clinical trials a little later in the semester. So these are the two offerings on research methodologies we have on our plate this semester. And then it will be followed by a session on REDCap, which is a survey as well as a data analysis tool. Very, very helpful for people who are interested in quantitative data. And quick turnaround surveys, and it can be plugged into operationalizing a survey instrument that you might have in mind. This will be followed by Dr. Bay's presentation on data analysis using SPSS, which will include a wide array of methodologies and basically using SPSS as a software to operationalize those different statistical methodologies. And then last but not the least, we will have a celebratory session on a secret topic. We will reveal it at the end of our research methods and research operationalization related discussions. So I'm going to give you a run through of our website, which can be found at this link. Dr. Degenhardt, I would probably need to share the screen. Just bear with me a moment. So this is problematic. Dr. Degenhardt, I would need your help with clicking on the screen on the link and scrolling. There's something wrong with Zoom and it's not letting me share my screen. So this is our new website. When you have a minute, I will share the link with you. Whoever are interested, you can reach out to me and at my email address, and you can find it in your email because that's the email address I use to reach out to you. It has a whole lot of information about what we do. And basically a snapshot of what Dr. Degenhardt and Dr. Spolarch and Dr. Degenhardt, a presentation on Dr. Lewis's research centers do. Most importantly, if you look at upcoming events, it will give you an idea of the upcoming events on Research Nexus. These are all listed, and we will be posting our attendance sheets, or the Google forms we use to collect attendance, in short order. We also have information on resources for, if you scroll down a little bit, Dr. Degenhardt, on resources we have for researchers who would want to learn about how to do research under information for researchers. And there are links to different resources like the library and research support. And when you have a minute, please do go in there and take a tour of our website. It's quite well updated whenever we have new items to post, and you will have information on all research, all most research projects that are being conducted through the research centers, and also potentially look for collaborators for your projects, because we have all information on the research center members who are part of our institute, and you can look at what they do, their research interests are, and you can contact them and see if you might want to collaborate or seek ideas. Then the next slide, Dr. If you go, sorry, this is if you X out of that, and then so next semester we are going to offer more methodology, primarily qualitative methodologies, which are not just restricted to survey. We might be able to offer some insights in the IRB process, because that has been something that faculty has asked for over and over again, but that's not set in stone right now. If you have suggestions or questions about our program, or you have ideas about new and new offerings that we can offer through our program, please get in touch with us through this email address, or you can contact me at my email address. Please look up our YouTube channel. Go onto YouTube and type in ATSRI. You will find the Research Nexus channel. Please subscribe, and you will get updates on new presentations, and all the resources we have till date. They're already uploaded there. So please take a look around. We also have a Facebook page. If you go onto Facebook and do the same thing, you will find our page. Please subscribe and like, and you get updates on our program, as well as research related activities that are done in the Research Institute.
Anything else, Deb?
Yes. Also, I think we're missing a couple of slides, so I'm going to go and talk about.
Okay.
We also have a survey, a corporate survey that we will be floating right after each session. One will go out to all the attendees today after the end of the session. Please fill it out and let us know what you felt about, how you feel about this, the new structure. We will appreciate all and every comment, and because we are continuously looking out to improve our programming. And that's it from me. Thank you, Dr. Degenhardt.
Well, thank you, Deb. You are putting together just a great program. It is every year, it is just becoming more and more developed and mature and exciting. So thank you for all the work and leadership you are doing with that. So the last topic area I just want to cover, because this is another event that the Institute is supporting this year. It is the 12th Annual Interdisciplinary Biomedical Research Symposium. In the past, this symposium has been held live here on the Kirksville campus. We've often had members from our Mesa campus join us for this symposium, as well as from the St. Louis campus. But this year, under the circumstances, this is going virtual like everyone else. And so as a result, this is providing an opportunity for a lot more people to participate and to get engaged with this meeting. The title for this meeting is Science, Society, and Advancing Health. Clearly, over the past year or two, we have seen how much science has been affected by a lot of other aspects of society, and how society is using science and or modifying science in order to address particular viewpoints. And so this meeting is really timely because it's focusing on issues that are current, but it also focuses on issues that are really inherently part of what ATSU is. When you look at our mission and our values, everything about understanding and utilizing science, engaging society in all of its levels to advance the health of society and advancing the healthcare system. Everyone should hear that that's ATSU. And so this provides a great avenue, a great opportunity for us to highlight the work that we've been doing, to highlight our vision as an institution, and to really engage our university and members of the community throughout the United States in this meeting. So we are really inviting faculty, undergraduate and graduate students, and clinicians to actively engage and to submit abstracts and to present their research within this meeting. But we're also, encouraging, as we have in previous years, asking any community members who are interested in research to join into this meeting and to learn about science, society, and advancing health, both from a national perspective, but also in what this university is doing as well. I do want to say, in regards to both the Research Institute and this meeting, not only you can reach out to Deb Roy for the Research Nexus, but Jessica Couric, my administrative assistant, is also somebody you can reach out to at any time in regards to if you're interested in joining the Institute, if you're interested in learning more about Research Nexus, would like to present for one of the sessions of Research Nexus, or you have questions about the Interdisciplinary Biomedical Research Symposium, feel free to email Jessica Couric at atsu.edu. So this is our program, and we've actually, it is because of it being done virtually and being wanting to engage the nation in general, we've shifted the time a little bit. So we will begin in Central Time at 10 a.m. So 11 o'clock East Coast. At that time, it's going to be then 9 o'clock in the Arizona area, and then 8 o'clock on the West Coast time. So everybody, it would be hopefully reasonable time for participating. Dr. Phelps, our president, will bring in the conference through the vision of the university. Our opening keynote will then talk about the challenges and associated implications of what is going on regarding healthcare and across the COVID across the country. We'll have an opportunity for some question and answers. And then after that, the center directors will have a panel presentation that will talk in much greater detail about the research they're doing, the results that they're seeing, the implication of those results on society. After that, we'll have an open discussion that will then wrap up that morning and lead us into a lunch break. We will have opportunity during that lunch break to be able to watch different shorter video clips about kind of leading edge activities that are going on within the university, as well as potentially nationally as well. In the afternoon from 1 p.m. to 2:30, so in that hour and a half time frame, we will have our virtual poster presentations. And this will be run within a Zoom platform. We anticipate having at least 20 breakout room sessions, and there will be 5 poster presenters per breakout room, and there will be 2 judges assigned to each of those rooms and a moderator to help to manage the presentations and the question and answers going on for those breakout rooms. Each poster presenter will have no more than 10 minutes to present their slides in a standard format, and there will be no more than 5 minutes for a question and answer for the judges and for any of the audience that have logged on to that session. Immediately following that, the judges will be making sure that all of their data is complete and has been submitted, while our closing keynote address will occur. And our goal is that this is going to look more towards the future and what are the opportunities that we have as a society, as well as a university and as individual clinicians, to help shape the advancement of healthcare through science. At the end of that, we will then have our award session. We have traditionally 6 monetary awards for the best poster presentations for those particular areas. So right now we're in the process of recruiting poster presenters. Yesterday, our call for abstracts went out, and so they can be submitted at any time from now through October 2nd to the end of the day of that Friday at 5 p.m. Central Daylight Time. Then we are looking for judges, and we are in need of having at least 40 judges participate. So you'll be hearing from us on that. We're also, we started this last year as a way of mentoring the next generation of clinicians to offer senior residents to be able to judge posters with seasoned judges. So they have the ability to kind of learn the process and learn the nuances of judging. So when they go out into practice and they are engaging their educational roles and hopefully participating in research as clinicians, that they actually have experience to take on this type of judging role. And we're also looking for breakout room moderators. We're hoping that we can solicit students within our various programs to be able to help manage the breakout rooms. Okay, so are there any questions about the Interdisciplinary Biomedical Research Symposium? Okay, certainly I can guarantee you, you'll be hearing more about this and from us to find ways for getting people involved. And then lastly, this is our next program. Dr. Joan Davis from our St. Louis campus will be presenting on how to write a research question, as Dr. Deb had mentioned earlier. Our websites will be highlighting that later on today. And I want to thank everyone for their participation and their time in our program. I think you're going to find a lot of good information in the Nexus series this year. So I look forward to a meeting with you again at a future program.